Hi, I'm Chuck Blahous with the Hudson Institute. The Obama administration has been promoting its healthcare agenda through the use of the slogan, "Healthcare reform is entitlement reform." The basic idea behind the slogan is that when it comes to diagnosing the long-term fiscal challenges of the federal government, it really all comes down to healthcare. It's not a broader entitlements problem. It's not a broader problem of population aging. It's not really a Social Security problem. The basic idea is that if we can just get healthcare under control, then the long-term fiscal picture will be okay. The problem is there are at least 4 different flaws with this particular slogan. One is that it's based on a misleading premise. The second is that it's actually factually incorrect. Third, it's very seductive, especially for the most irresponsible politicians. And fourth, if we follow it to its logical conclusion, we're going to face disastrous fiscal consequences. Now, why is the slogan misleading? It's misleading because it's based on the first observation that healthcare costs are growing faster than costs in the economy as a whole. Now, that's certainly true. But if you project that trend forward over decades and over all time, then of course it's going to look as though it's dominating every other trend in federal finances. Compare it, for example, with another trend, population aging. Now, that trend is largely going to play out over the next 25 years as the baby boomers head into the retirement rolls. Now, obviously, if you can compare one trend and assume that it occurs and extends forever, and compare it to another trend that only lasts about the next 25 years or so, then of course the first trend is going to seem as though it is the dominant one. But the reality is that the federal fiscal problem does not only arise 50, 75, 100 years from now. It's actually something that's going to play out much sooner. Over the next 25 to 30 years, the federal government faces a very dire fiscal challenge. And over that period of time, it's actually population aging, not healthcare cost inflation, that is the largest driver of federal spending growth. So if we ignore the phenomenon of population aging, we're actually going to be ignoring the biggest contributor to our fiscal problem over the very period of time that we have to solve it. And so for that reason, the slogan actually is not even factually correct. It's also very seductive, and in particular it's seductive in sending exactly the wrong signal to irresponsible legislators. It basically tells them, you don't have to deal with Social Security. You don't have to deal with other entitlements. In fact, you don't even have to worry about the fact that we're going to have more and more beneficiaries taking benefits from Social Security and Medicare. If we can just get health care cost inflation under control, then the whole situation will correct itself. Now, following this slogan through to its logical conclusion is going to lead to disastrous fiscal consequences. First of all, it tells legislators to basically ignore Social Security, or that they can ignore Social Security. And every year that we wait to solve that problem, the costs grow larger and the hole grows deeper. At the same time, the Obama administration is actually proposing to worsen the problem on the healthcare side. They're actually proposing to increase federal commitments over the next decade by over $600 billion for expanded healthcare coverage. Now, they're proposing to offset roughly half the cost of that over the next 10 years with increased taxes. But over the long term, this combination of measures is actually going to make the fiscal situation worse. Think about it. If you increase federal commitments in an area where expenditures are rising faster than GDP as a whole, and you propose to pay for it with increased taxes, which can only grow with GDP as a whole, then over the long term, you're going to worsen the imbalance between the federal government's expenditures and its incoming revenue. In summary, the federal government faces very dire fiscal challenges in the years ahead, and we're going to have to make some very tough choices in order to correct them. Now, relying on slogans such as healthcare reform is entitlement reform, that may be adequate in a campaign environment, but it's really not adequate for the serious governance tasks that we now face. The reality is that expanding federal healthcare commitments is not entitlement reform, and it will not correct our long-term fiscal situation, and we should be under no illusions that it will. I'm Chuck Blahous, again with the Hudson Institute. Thank you.